Good morning and welcome to Webinar Wednesdays with SMP. We're really happy to have you all here with us this Wednesday morning. My name is Sunny Lawless and I am the Assistant Program Director and Volunteer Coordinator for our SMP programs. I'm going to be your host this morning. Presenting for us today is Johnetta Red, who is our Complex Interactions Specialist, and Danielle Guillory, who is our Mississippi Team Lead and Community Outreach Specialist. Today, for our February installment of Webinar Wednesdays with SMP, we're going to talk about the Medicare Summary Notice, which is an MSN, or an explanation of benefits, which is also known as an EOB. During the presentation, you're more than welcome to type any questions that you might have into the chat, but we're going to hold all of those until the end of the presentation when we open things up for Q&A. There's also going to be a prize drawing at the end for those of you who registered to attend today's webinar prior to 10:15 a.m. this morning. We'll be doing a prize wheel and raffling off a $25 Amazon e-gift card. So you do need to be present to win. Before we get started with today's presentation, I do have to let you know that this project is supported by the Administration for Community Living, Department of Health and Human Services as part of a financial assistance award with 100% of our funding by ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. For those of you who are new and just joining us for the first time today, we wanted to give you a little background information on SMP. So who is Senior Medicare Patrol? Well, SMPs are grant-funded projects, as I said, of the U.S. Department of Health and Human Services and the Administration for Community Living. Every state has its own SMP program, and our SMP programs are sponsored by AdviseWell, and we have the SMP programs in Georgia, Louisiana, Mississippi, and Vermont. The mission of SMP is to empower and assist Medicare beneficiaries, their families, and caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education. Before I turn things over to Johnetta and Danielle this morning, we do have a quick polling question for you. And today's question is, are you on Original Medicare or do you have a Medicare Advantage plan? Give me just one moment to launch that poll. So are you on a Medicare Advantage, or Original Medicare, excuse me, or do you have a Medicare Advantage plan? And your options are Original Medicare, Medicare Advantage plan, I'm not sure, and one, I don't qualify for Medicare just yet. So we'll give everyone a few seconds to answer the poll. Okay, we'll give about another 5 seconds and then we'll close the poll out. All right, and let's share those results with everyone. All right, so it looks about 25% are on Original Medicare, almost 20 on a Medicare Advantage plan, and the majority of you don't even qualify for Medicare yet. So that's what we're going to talk about today is those Medicare Summary Notices and those explanation of benefits. So once you do become eligible for Medicare, you'll understand those a little bit more and how you can use those to fight fraud. Go ahead and hide that. And I will turn things over to Johnetta, who will get us started with our presentation today.
Thank you, Sunny. Medicare Summary Notice. The Medicare Summary Notice, also known as the MSN, is a statement that people with Original Medicare receive. Medicare mails the MSN out every 3 months for their Medicare Part A and Part B covered services. If you don't receive services or medical supplies in that 3-month period, you will not receive an MSN. The Medicare Summary Notice the Medicare Summary Notice shows all the services billed to Medicare for you, both the Medicare Part A, which is inpatient, and Medicare Part B, which is the outpatient. Next slide. Explanation of benefits. The explanation of benefits, also known as the EOB, is a notice that people with a Medicare Advantage plan, Part A, or Part D prescription drug plan receive after they receive services or medical supplies. These are mailed every month depending on which Medicare Advantage plan you may have. All EOBs show the same information, but the layout and other specifics may vary by plan. Next slide. The Medicare Summary Notice and the explanation of benefits is not a bill. This is a record of what services or products Medicare has paid for on your behalf. It is very important that you review your Medicare Summary Notice or the explanation of benefits to make sure that the information is correct. Next slide. So now let's take a few minutes to review a sample of the Medicare Summary Notice. The first page of the Medicare Summary Notice will have your deductible status, claims and cost for that period, the total you may be billed, and the providers who submitted claims for that period. Next slide. The second page of the Medicare Summary Notice provides you with information on how to check your notice, report fraud, or where to call to get help if you have questions. Next slide. The next few pages of the notice provides you with detailed information on your claim. The claim information shows the date of service and the name of your provider, as well as a detailed description of what services were provided. Next slide. The final page explains how to handle a denied claim and how to file an appeal. For assistance in filing an appeal, contact your state SHIP. And SHIP stands for the Senior Health Insurance Assistance Program, and every state has a SHIP. Next slide. Okay, if you are on the Medicare Advantage plan, you will receive an explanation of benefits or the EOB. You will not receive the Medicare Summary Notice. Your plan will send you one of these after services are received. This statement will also show the date of service, the name of the provider, and also detailed descriptions of services that were received. Next slide. When reviewing your Medicare Summary Notice, we suggest using a personal healthcare journal or a pocket calendar to keep track of services or equipment that you have received. A healthcare journal is a booklet that allows you to keep track of every aspect of your medical information and to keep it in one place. It includes a section for you to list your doctor's appointments. You can also record the date of your appointment, your doctor's name, and the reason for your visit. You can also track the dates of your test, of your labs, and also your x-rays. Next slide. Check for accuracies. Always look at the information to make sure that it is accurate. Check the dates of service and match it to your healthcare journal or your calendar. While checking, think of the questions. Do you recognize the provider's name? Did you receive the type of services that were listed? Did you receive the x-rays? Did you have the lab work or the tests? And also make sure your provider is charging you the correct amount. Were you charged more than once for the same services? Next slide. Review your Medicare Summary Notice and your explanation of benefits when it comes to ensure that there are no unusual charges and suspicious claims. If you see something that you don't recognize, such as a provider's name, or if you don't recognize a date of service or a test that that shows up on the statement, contact that provider. And if you're not satisfied with the answer that you receive from the provider, or if you don't feel comfortable calling the provider by yourself, you can always contact Senior Medicare Patrol. Our number is 877-272-8720 for help. Next slide. Now we'll turn things over to Danielle, who will review the SMP 3 Keys to Success in Preventing Medicare Fraud, Errors, and Abuse.
Next slide, please. Good morning, everybody. So the first key to protecting your information is to prevent Medicare fraud. It's your best defense against healthcare fraud and abuse. And the ways to do that is never share your Medicare number with anyone who is not a healthcare provider. So you want to bring your Medicare card to your doctor's office, to your pharmacy, if you have to have lab work or x-rays. But other than that, you don't give it out to anyone else. You only want to carry your Medicare card when you know you're going to use it. And remember, Medicare never calls you and asks for your Medicare number for any reason. If Medicare is calling you, they already know your number. Keep records of all your medical visits and procedures that take place, and make sure that the medical equipment that you are being billed for is what has been ordered by your physician. Next, please. The second key is detection. So, knowing how to spot a suspicious activity can help you stop healthcare fraud and abuse in its tracks. You want to review your Medicare Summary Notice or your explanation of benefits. Your Medicare Summary Notice, as Johnetta said, is mailed to you every 3 months. If you have any type of Medicare Advantage plan, you're going to receive an explanation of benefits anytime you've received healthcare services. That may be multiple times in a month, or it may be months in between. It just depends on whether you've been to had pharmacy or you've been to your physician. You want to be sure that you are comparing those statements to your personal records. Was that your medical appointment? Did you get double billed for something? Was the medical equipment that is on your Medicare Summary Notice or your EOB something that you actually received or was ordered by your physician? That can be braces, catheters, diabetic supplies. A lot of times we're seeing things that were billed that the physician never ordered for you. Next, please. And the last and final key is report. If you suspect you have been a target of fraud, report it. This will help you and others at risk for healthcare scams. Here are some steps to report suspicious behavior. Did you receive a suspicious call and give out your personal information? You need to report that call immediately to SMP. If you have questions about your Medicare Summary Notice or your EOB, you can call your healthcare provider or your healthcare plan. And if you aren't comfortable calling your provider or you aren't satisfied with their response, call SMP at our 877 hotline number, which is shown on your screen. That is 877-272-8720. Next, please. So how can you become involved in our fight against Medicare fraud and abuse? Senior Medicare Patrol is always looking for individuals who want to volunteer for our program. Our volunteers receive training on the basics of Medicare and healthcare errors, fraud and abuse, and scams. In addition to giving presentations and attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. We also host a volunteer appreciation event in April for National Volunteer Week. Volunteering for the SMP program is extremely flexible, and it's done on an as-needed basis. They determine how often they would like to participate. If you think volunteering for SMP is something you might be interested in doing, give us a call at our toll-free number and we'll send you a volunteer information packet and answer any questions you might have about the process. Next, please. If you want to stay up to date on the latest scams impacting older adults in your community, just scan the QR code that is on your screen right now using the camera on your cell phone, and you'll be guided to our social media platforms. This includes Facebook, and we have a Facebook page for Georgia, Louisiana, Mississippi, Vermont, and our Spanish Facebook. And we also have YouTubes and podcasts. Our podcast is called Sip and Learn with SMP, and it's on Spotify and Apple Podcasts. Our state-specific SMP Facebook pages are especially a great resource for older adults and their care partners to find out about hot scams happening as soon as we learn about them from reports called into us or from our community partners. Next, please. As mentioned in the previous slides, we have a toll-free number, 877-272-8720, and you can call to report potential healthcare fraud or to ask us questions about potential fraud, and even to request we attend your event or speak to your group on our fraud prevention message. SMP cannot be successful in fighting Medicare fraud without reports from people like yourself and invites allowing us to reach older and disabled adults in your community. Additionally, you can visit our website, www.stopmedicarefraud.org, for more information on the SMP program in your state. Our website can be viewed in multiple languages by adjusting the language tab, which is at the top right part of the screen. Next. I'm going to turn everything back over to you now. Thank you so much for listening.
Thank you, Danielle and Johnetta, for that information. So coming up next month for our Webinar Wednesdays, we're going to be talking about how you can protect your identity from scammers. So the entire month of March, we are going to dedicate to preventing identity theft. So we'll hope you'll join us again then. Just kind of be on the lookout, and we'll send you the invitation with registration information when we get closer to that date. All right, so now it's time for our prize drawing. So as I mentioned when we first started, everyone who was registered to attend today's presentation prior to 10:15 a.m. this morning, your names have been entered onto our prize wheel, and the winner is going to receive a $25 Amazon e-gift card, and you do have to be here to win. So let's go ahead and open up my prize wheel, and we will give it a spin. All right, it looks like Teresa Huggins. Let's see if Miss Teresa is on the call today. I don't see her, so we'll give it another spin. All right, let's see, Miss Eleanor, I do believe I saw her name. Yep, Miss Eleanor is here. So Miss Eleanor, I will reach out to you a little bit later today to make sure that we can get you that gift card, okay? Let's see, let's go ahead and get back to my screen. There we go. All right, so before we wrap up today's presentation, I do want to open the floor for questions if you have any. If you'd like, you can raise your hand. If you see the little hand icon on your GoToWebinar control panel, you can click on it and I'll raise it and we can unmute your line and you can ask us a question about today's presentation or the program itself. I'll also check the chat real quick to see if we had any chat messages. All right, well, I'm not up. Let's see. Okay, well, I don't see any hands raised, so we're going to go ahead and this will conclude our presentation today on understanding your MSN and EOB to fight fraud. You will receive an email after the webinar today with a link to a very short survey. We would really appreciate it if you would take just a few moments to complete the survey so you can let ACL know how we did with today's presentation. We hope you have a good day and we hope to see you again soon at Webinar Wednesdays with SMP. Thank you again to our presenters, Johnetta and Danielle, and see y'all again soon.